going back to the training, do you find easier to train humans or easier to train the LLM?
It's a little bit of both, I would say. It's funny, as an oncologist that went through a lot of training to become an oncologist, think about what that took to train me to do that. I just think it's humorous that when we're prompting the LLM, we'll say, "Imagine you're an oncologist." I mean, that helps. I would say the LLM better frame the problem that it's trying to do, and that's
Yes.
like a sentence of text, and all of a sudden they have ostensibly the training that I have. And so in that sense, LLMs are really cool and nimble and agile
Hmm.
because you can
Hmm.
make changes to the processes, iterate, do error analysis, and go back and change things in a way that's just much easier than certainly working with humans, and certainly working with more traditional supervised learning approaches where you're limited by the labels that you have and that the models learn from. And it's not easy to change those rules that it's learned without collecting all new labels. That said, there are still some things that um, we're finding that LLMs can't do very well, or as well as we would like them to do or need them to do, to do the important research and use cases that we're interested in. Um, I would say one example of that is they're not very good when the answer is not there. I talked
Yeah.
about no and unknown earlier, right?
Hmm.
And
Hmm.
a human, they will do their due diligence of looking through the chart to see, did the patient have progression, yes or no, or unknown. If they don't see it, they will reliably say, I didn't find this, right? What we've had issues with and discovered with large language models is they don't like to give that answer. They will, and everyone has heard of hallucinate, but I don't think people might realize what that means in the context of what we're talking about in terms of real world evidence and data curation. Um, for the purposes of this, they will confidently say patient had progression on January 1st, 2022. And it sounds confident. It's entirely plausible, but it's not there at all. And so, that's one area that we've had to really think about. How are we in a position to evaluate these large language models accurately and know when those errors are happening?